Are you ready to look like a burn victim?
Because she was kind of like a witch.
It's just my hot take.
Suck it up, put your sunscreen on, put on a little bit of makeup, go to work, do your thing.
Ugh.
Oh, it's laser season.
Lauren said it was shitty. I literally think it was hemorrhoid cream.
Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way. Okay, one of our favorite topics, lasers. So sunspots, skin tightening, they really do it all, but you have to be the perfect candidate. There's a lot that goes into being a perfect laser candidate, the downtime, the cost. So we will dive into all of that today. So you feel like you are a laser professional and you know exactly what to ask.
You're going to know all about it. Lasers are complicated and complex. And I think a big misconception is that patients will see a laser online and just think that it is what they need. And I think that there are a ton of lasers on the market. There's a ton of companies, a ton of devices, and the best one is going to be the one that your professional works the best, has the most knowledge about, because a lot of them can deliver very similar results. We're going to get into some basics and just break them down so that you know how to choose, but just also knowing that just because it's not that specific brand that you looked up doesn't mean that this other one doesn't work just as well.
I agree. You know, it's really gaining the knowledge from your medical professional, trusting in them, and knowing that they're picking what's right for your skin.
Right.
And we can get into some personal experiences.
I know, because I have one right off the top of my head.
I know, me too. We had almost the same experience. A patient came in and they wanted this laser. I want this laser. My friend got it. I want it. And I was like, whoa, whoa, whoa. You're talking about a really aggressive laser here. You're not on any good skincare. We don't have your skin prepped. Are you ready for a week of downtime? Are you ready to look like a burn victim? She's like, wait, what? And I'm like, yeah, you know, you can't just come in. It's not just like this menu you get to pick off a la carte.
Yeah.
So I think you had that same experience.
But kind of like worse.
Oh, really?
Yes, because she was kind of like a witch.
Mine was too. I swear when you posted about that, I was like, is this the same patient? Because she was not
So
very
demanding.
kind. Yes.
And when I told her we didn't have, it was a Fraxel, which Fraxel's in here and we can talk about it. But Fraxel is very similar to Moxi. It's very similar to, like Helix, honestly.
Yeah.
They give very similar results. But she was dead set, I have to have Fraxel. And that's it. And I was like, well, do you want to talk about anything else? Nope.
Mine too. Mine was the same way.
And I was like, I can't help you. And she's like, okay, bye. I was like, all right, peace out, girl. So
did she say why she wanted Fraxel? Like, was there like
she had it done once before, maybe 10 years ago, but at the same time, like, she didn't have good skincare. She was overfilled cheeks and lips. You can tell, like, only maybe had just gotten Botox in her forehead, like very classic.
Yeah.
You know.
Well, it seems
was
like
fine. I was like, this is not somebody that I want to treat anyway.
Yeah.
So.
Yeah. Anyways, you are going to be equipped with a lot of information. We are going to try to go in depth, but still keep it like 101 level, so you feel like you've gained a lot from this and you're more equipped with laser knowledge. But it is a little bit more in depth than just like your basic knowledge. So there's types of laser categories that we usually think about: ablative, non-ablative, and then you have like your BBL photofacial lasers that are targeting a specific wavelength.
Yes. So starting off with ablative, these are our heavy hitters.
Our bulldozers. These basically vaporize or remove the top layer of your skin.
Right. So I think what's important about these is knowing that they are attracted to water. So all different lasers have different things that they're targeting. These are water-based. And so really what I tell my patients a lot when we're prepping is like, lots of water, lots of hydration, increase your hydration in your skincare. Let's get you on a ton of mask. You want the most water content in the skin so that when that laser hits, vaporizes the tissue, you get a really, really good response.
Yes.
So.
And then typically that can come with quite a bit of downtime.
Yes.
because it's targeting water. So you can definitely expect swelling with these lasers.
Yes.
The main ones are CO2 and
Mhm.
erbium. I feel like those are the most popular, well-known out there. We have a CO2 in our clinic. We use CO2 a lot. CO2 is definitely going to be your more dramatic, but more downtime.
Right. And especially a fully ablative,
Yeah.
which we can talk about as well. So fully ablative and then
Non-ablative.
well, it's like fractionated.
Yeah.
So that's kind of hard. Where this is where lasers get a little bit complicated. You can have fully ablative where it's what? It's like
It's like a
mowing the lawn.
lawnmower.
Yes. So all the grass is gone.
All of it.
And then you have a fractionated ablative laser, which basically pokes holes. So it's
Exactly.
like an aeration.
It's like
Who
aerating
knows
your
stuff about
lawn.
lawns? It's like aerating it, poking holes in it.
Yes.
And so, but traditional ablative CO2 is, I think, like in the past.
I do too.
I don't think anyone really uses it much.
Yeah, these were in hospital settings, surgery, OR settings. We don't do this anymore, and I think that's where fractionated ablative, non-ablative really shine, because you don't have to have your entire skin removed
Right.
to get really good results.
Yes. So some caveats or some downsides to that were a lot of hypopigmentation. So you would see people who were one color of their face and then their whole like mouth was white. Or their whole eye was white. And it was so much heat in the tissue that it killed all the melanocytes and you could not repigment the skin. So that's why they're really not used at all anymore. And some people who still do use them, I see this hypopigmentation all the time. Patients come in. I had somebody actually get a facelift in maybe like the Villages 2 years ago, and this person is using a CO2 laser in the operating room, still fully ablative, and she came in and had full hypopigmentation around her mouth. And I'm like, there isn't anything that I can do about that. And that's unfortunate.
And a little bit of a caveat, this is not pertaining to lasers at all, but this is why I don't love 35% TCA peel. That is just my hot take.
Yeah.
We do these in the OR. I don't like them. They are, they just take off too much pigment and you look like you have white around your eyes and your mouth.
Yeah.
I don't like them.
It's very like depth. You have to be able to control your depth. I mean, like, you're doing a peel, you're putting it on like a paintbrush.
And it's a person doing it,
It's a person.
So it's like,
if you go too deep in one area and then you're too light in another area, the variability there is too much, and that's why lasers are way better. You set the depth, you set the target, you set the level, and like it does its thing.
And don't get us wrong, like just because a laser, you sort of set these settings, your professional can do you wrong when it comes to a laser too. And that's why you really have to go to someone who knows what they're talking about with anything. You've heard us talk about that multiple times. Even with Botox and filler, they have to know what they're doing. But so that's your ablative. Think of your ablative as truly like your bulldozer, your heavy hitter. These are vaporizing that top layer of the skin. It is perfect for people that come in with deep lines.
Right.
They haven't taken care of their skin for a lot of the time, and they're looking / need a big, strong laser.
Right. Yeah, you have to, some of those patients that we talk about, the 50s, 60s, who have really been out in the sun a lot, and they have, for lack of a better word,
we love this word. I know what you're going to say.
Looking skin. It's just like crinkly. It kind of sticks together. It's that classic
loss of
glycation.
collagen. Yeah.
They do really well with this, but again, they have to be pre-treated super well with lots of hydration. I think that they don't get as good of a response if they're not pre-treated to increase the hydration levels because they're lacking so much. But they respond really, really well to more aggressive ablation. And it sucks because the downtime is there, but I don't, and I talk to a lot of patients about like, oh, you could do a less and it's going to be 3 sessions. And like, it's going to help, but like the one really hard one is certainly, I think, the way to go if we're really trying to change a lot in the skin.
I agree. I usually will say 1 to 3, just because that's a good insurance policy, but 1 to 2 treatments to see significant changes. I love this quote. I feel like it's going to the gym once or twice and seeing abs, which we all want. But truly, like if you are willing to invest in skincare and prep your skin, hydrate, do all of the pre-procedure advice that we give, you're willing to do the recovery of 7
A
to
full
10
week,
days,
a full
yeah,
week, yeah.
yeah, then you could probably see significant, amazing results in 1 to 2 sessions of
Yeah.
this. So,
You
again, this
have
is
to
why it's
really
our
plan because the downtime is significant. I think that patients get downtime wrong all the time because downtime is not like some mild redness and a little bit of swelling the next day. Like, suck it up, put your sunscreen on, put on a little bit of makeup, go to work, do
mhm.
your thing. People down, that's not what downtime is. Downtime is this when you literally are oozing.
Mhm.
You have
Yes.
liquid coming out of your skin. You're oozing, you're weeping, you have made a full burn in the skin. That's downtime. You got to stay home and take care of that. But these little things like microneedling and lighter lasers and a little bruise, that's not downtime. We got to get over that.
Agree.
Yeah.
Yeah. So you covered a little bit of the risks. Big risk is hypopigmentation. With these, like we've said, we're vaporizing that top layer of skin. Your skin is a barrier, so you're prone to infection.
Hmm.
You're prone to rebound pigment.
I think that's more what we see than hypopigmentation.
The rebound hyper,
Rebound, yeah.
yeah. I've had that a few times with patients, and we
Megan
treat
is
it.
very aggressive. Like, I mean, I would consider her most aggressive. I'm here, and then our other injectors maybe down here. So she really will push the skin hard, and it's great because she has fantastic results. Like, her before and afters are amazing, but she deals with a lot more complications, I think, because of
Yeah,
that.
recently there was 2 people that I can think of that come up, top of my head. My beautiful patients, but we got it taken care of. We're still working through it.
I think just because you have a complication doesn't mean that it was bad.
Yeah, it was some rebound pigment.
It was
So,
just a rebound
yeah.
issue.
Yeah.
And so we're prepared to deal with it when it happens, and you
Yep.
can. So you have a patient who comes in with this hyperpigmentation. Now there are steps that we have to take, right? Like, we put them on chemical peels and we put them on pigment inhibitors. We get them some microneedling or a different type of laser. And so there are ways to deal with it. It doesn't mean that we've, ruined the patient,
Yeah.
but it comes along with doing aggressive treatments.
Yeah, and I prepare them for that. And that's why, I mean, you just said I'm much more aggressive. We probably would have had more complications if they don't follow the pre-procedure protocol.
Yeah.
So, like, that's just really important to me. And these patients followed everything to a T. There was no way to know that they were going
Right,
to have
that
some
was gonna
rebound
happen.
pigment, and they're fine now. But okay, so the cost of these lasers is going to be a little bit more than
Higher, for sure.
yep. So you're looking at probably starting at
15,
1200,
yeah.
1500. I mean, upwards of like 2000.
Yeah,
These
3,000, something like that.
mhm.
Some of these are really intense. I mean, the ones that we have in our office don't get into that price range, but some of our some other devices that are on the market that really
Mhm.
transform the skin are 2,500 bucks for sure for one
Yeah.
treatment.
And then we've talked about who a good candidate is. That's someone who has those deeper lines. They have sun damage. They have collagen loss. But also, really, you have to be in a skin tone range.
Hmm.
We call this a Fitzpatrick scale. And that's Lauren's skin color. Really, you're kind of pushing me at this point because I'm a
I
little
know
bit
you
more
are
tan.
tan.
So we call this Fitzpatrick 3 or 4. You
Yeah.
don't want to do a heat inducing laser really to patients that are a Fitzpatrick 4, 5, 6.
Yeah, so 4, 5s, and 6s are going to be like Latinos, Asians will
Asian.
fall into this, African Americans fall into this, any sort of that Middle Eastern background, those are going to naturally put you already at the end of the scale. And even if you are fair, you still will respond like this. So I
Yeah.
think that's a misconception too. You'll see, we talk about Asians and how beautiful their skin is. They are paler people, but they still respond at a 4, 5, and 6 level. So you have to be very cautious when treating them because they will turn very quickly, even though they look lighter.
Right.
So
Yeah, so you have to be cautious with them. Again, those pigment inhibitors. Yeah,
it's great
so
for acne scarring too. So I have a ton of
oh yeah.
patients um, who have old acne scars, and so this is a really great way to try to smooth out the skin. It takes a lot. It's a lot of patience. It's a lot of hand holding. They go through several rounds of recovery, but they can get some really great results to smooth out just like old teenage acne scars or even adult acne scars. So I love it for those patients
Yeah,
as well.
agree. We both have a few and they take time.
Yeah.
So just know that if you have acne scars, you are not alone. There is a treatment for you,
But it
but
takes a while.
it takes time and money and you have to have that patience.
I've
So,
been treating one of my patients for a full year. I think. We have done probably 4 or 5 um, lasers on her. We've done some other things to try to improve her scarring. She's gotten amazing results, but we're still really working to continue to try to smooth it out. So she's been very patient, and she goes through a lot of downtime, and she's a trooper, but it
She
does
is.
help.
Yeah, she's done a great job.
I know.
Okay, so next category
Let's
is
get into the next one. Yeah.
non-ablative lasers. So we just talked about ablative. These are non-ablative. So these are heating the deeper layers of your skin without removing that top layer. This is like your friendly neighbor that brings cookies over, but she's still like good for your life.
Yeah, yeah. I think I like these more because I don't love downtime. I don't like skincare that makes your skin irritated or red, and I don't love a lot of downtime. Even though I'm perfectly comfortable coming in with a red face. I just think in general, I just don't want to deal with it. And I have a lot of patients who don't either.
Mhm.
So I love a lighter laser.
Yeah, these can be a lunchtime laser. We will really get into like our lunchtime laser that we like to do, but these non-ablative ones, again, like they don't remove that top layer.
Right.
So yeah, you'll have a little bit of a gritty feeling to your skin.
Some
You
mild
might have
redness.
some swelling, some mild redness, but it is not creating that wound or the chances of the hypopigmentation and the infection.
Right.
So these are Aerolays.
Yeah, so Airlace is
Moxi.
a big one. I feel like that one got really popular recently.
Mm-hmm.
Laser Genesis, which again, these are all like brands. This is not important for you to know brands. It's really just important to see a provider who can distinguish ablative,
Oh, yeah.
non-ablative.
I just
right?
wanted y'all to know, like, I'm sure that the Aerolays, the Moxie, these
Yeah.
are like these little trigger words that people hear all the time.
Right,
So,
But
but I
these are-
agree with you.
Yeah, and I think that so those two that we just talked about, the Airlace and the Laser Genesis, are going to really help with people who have darker skin.
Yeah.
Can really have these lasers. So this is where 4, 5s, and 6s can really start to utilize lasers, and they have much less risk.
Agreed.
And they can still get really pretty skin. They can get really great collagen stimulation from these, but these are going to be more of your safer bets when it comes to darker skin types.
Agree, yeah.
Yeah.
So this is doing a little bit of resurfacing, mild. It's going to help for fine lines and wrinkles. It's good for prejuvenation. So this is great for people our age, in their
And
40s.
younger, yeah.
They take great care of their skin, but they're just looking for that extra oomph
Mhm.
of what can I add into my skincare routine that is going to bring me to the next level. Also, I am worried about me being 40 now. What can I do laser-wise to
Mhm.
build a little bit of collagen and help my skin look good?
Yeah. I think also treatment frequency here, you're going to have a lot more.
Yes.
So whereas like our ablative lasers, you can have one and have really great results. These are more like treatment series. So you really have to think of them as 3 to 4 sessions at minimum, sometimes more than that. And sometimes patients just like them and get them monthly or quarterly.
Mhm.
And it's just like that maintenance that you're doing. But definitely don't go in with the expectation that it's one and done, because that's not
Agreed.
the laser for this.
Yes, and so knowing that it's not one and done, yes, the cost is less. So now we're looking at like 500, upwards of a few thousand. There are some.
Yeah.
But just knowing that the frequency is much higher. You are not going to get the same results in 1 to 2 sessions like you would with our ablative CO2 lasers.
Yeah. So think, little recap, ablative, more mature skin, people with a lot of texture, a lot of things going on. Non-ablative, younger skin, healthy skin, just maybe some mild changes that we want to make that skincare just hasn't been able to like get you there.
Exactly. That's great.
Yeah.
And like Lauren said, this is perfect for our darker skin toned
Yes.
people. So they get a laser too.
Okay, so we briefly touched on fractionated, and so I think that's, we can kind of get into that a little bit more, but we talked about fractionated, which is tiny little columns of ablation, and that's where we love our Helix CO2 laser. It's been the newest, it's like, I don't know, what's a fancy car?
It's like the Tesla. It's like, I
Okay.
feel like it's like a Tesla of lasers. It has that new technology.
Mhm.
You know that you're gonna get a good product.
And there's so little, like, I feel like risk, and you can really decrease the downtime. It just makes them a lot safer. So Helix, I think, did a really good job when they came out,
Mm-hmm.
they, I think, really changed the market when it comes to CO2 lasers, because again, we just talked about CO2 being not the gold standard anymore, but they've kind of like reinvented the wheel here. And I think that that's been super helpful
Yeah.
at keeping CO2 around.
Agree. So, like Lauren said, if you take your knowledge that you just gained about ablative,
Mm-hmm.
then take your knowledge of non ablative,
Mm-hmm.
and then now take what you know about fractionated lasers, combine them.
Right.
That's what a helix laser is. So, this is going to help with a little bit of downtime.
Yes.
You're still, depending on what we agree on, what your goals are, you still can potentially have quite
Yeah,
a bit of
of course.
downtime. This laser is still going to pack a punch, and it's still going to be a little bit costly, but again, you can probably get away with 1 to 2 sessions versus and like Lauren said before, this is aerating your lawn. This fractionation basically leaves pieces of skin behind. I found a good photo on the internet, so we'll have that on the screen. Perfect to show you like what all this looks like underneath the skin.
Mm-hmm.
But again, like almost drilling little holes into your skin and leaving other little pieces behind.
Right.
This is how we get away without mowing your entire skin
Mowing your
/ grass down.
Yeah, so, and the important part about that is it leaves healthy tissue intact. That healthy tissue in these little columns has little tiny blood vessels all in it, and so those blood vessels are kind of able to almost attach themselves to the burned column and helps it to heal much faster. So it's leaving all these little pieces, and that's how your downtime is less and your recovery is a little bit better, and now we have less of these really horrendous side effects.
Yeah. So examples of these, again, just your little keywords that you've probably heard on TikTok: Clear and Brilliant,
Mm-hmm.
Moxi, and then our lover. Well, we love Moxi too, but Cool Peel.
Yes.
Cool Peel is a great fractionated ablative, non-ablative laser.
Yeah.
It's your really superficial light lunchtime laser. You have maybe 24 to 48 hours of downtime, and then you're good to go.
Yeah, and Moxi, we haven't really talked about very much.
Let's talk about it.
And I guess we just covered ablative fractionated, so it's in the non-ablative fractionated.
Yeah. We mentioned its
landscape.
name, but we haven't like dove into it.
It's become, I think, one of my favorites because you can use it for so many different people and so many different skin types, and the downtime is very limited. You can have 24 hours of some redness. Besides having texture, that's not downtime.
Correct.
Let's get it correct. That's not downtime. You have mild redness.
Mhm.
It's so mild.
Yeah.
You can go the next day, no one's going to be able to tell other than you have some roughness that's starting to appear. That goes away within a week. So I love this for anybody who can't take off work, who has a very face forward job. Like, these are really easy to do on a Friday.
Yeah.
And by Monday, you're good to go.
And like we said, this is good for the more pigmented skin tones and also great for melasma people.
Yes.
So I want to do a Moxi on my upper lip melasma right now, but I don't see a point because it's still July.
I think you could.
Ugh.
You could. I mean, I just did a patient's Moxi on her melasma, and she texted me, and she's like, "It's amazing."
I'm on
She's like,
two.
"It's so much better. I need another
I need
one."
it. Maybe I just go for it.
Yeah, I don't think that there's a problem getting it done now. I think that's the beauty of Moxi right now. I don't love full ablation in the summer whatsoever, because as much as people tell you I don't go in the sun, they're liars.
Agreed.
Straight up. Megan walks her dog every day for probably 2 hours. That is sun exposure, and it's a lot of sun exposure for that long. So people who just think they're walking their dog.
But even when you're at lunch running an errand, when you have to go to FedEx or Walgreens or go get Chick-fil-A at lunch.
Unless
like
you're a hermit, then it's
Which
not the
most
best
people
idea.
aren't. Yeah.
But Moxi, again, this non-ablative fractionated laser is great in the summer because it doesn't break the skin. You still have to be sun conscious, but you just have way less risk.
Yeah.
So I think, I think it was a catchy term to be like, oh, it's laser season. But we do lasers all throughout the summer. You just have to pick the right candidate.
Agreed.
And you have to be very forward and just drive it home how important their skincare and getting out of the sun is. And they almost need to sign a contract.
I know.
I will agree to do this.
I know. We are very intense about that for good
Yeah.
reason. We don't want you to have complications. Sometimes it happens, but we who wants that?
No.
As a provider, that is the worst thing. Like when my patient texted me and she was like, "Megan, I have a little bit of pigment after the
Right.
laser." I was like, "Wait, what?"
Yeah.
Like coming out of my,
I know.
coming vertical out of my bed.
Yes.
Okay, let's go on to our last
Okay.
category. This is also a fan favorite, a very catchy word, the term BBL by Saiton.
Not a Brazilian butt lift. I get
Not
that
to be
all
confused.
the time. They're like, "Are you talking about a butt lift?" I'm like, "No, we're not. We don't."
I wish.
Yeah.
But BBL is a term. So there's a term.
Broadband light.
Yes.
That's what that means.
IPL lasers are intense pulse light. This is sort of our umbrella term. Saiton came around and created this amazing technology, which is the BBL. This stands for broadband light, like Lauren said. And it's basically attracted to different types of pigment or melanin or hemoglobin, which is blood in your skin.
Correct.
So these are our complexion lasers.
So they use filters. It's a completely different like this is not a laser.
Right.
It's a light. And the light goes through these different filters to attract to these different concerns. Like Megan said, pigment, blood, those are kind of the main targets for BBL and IPL.
Yeah, so basically we just kind of pick a filter based on your skin concern. It's attracted to that. It brings it to the top of the surface, and it's either reabsorbed by your body or it sort of sloughs off.
Yes.
So with these, you have to be the right candidate.
Yeah.
Your we just said that it's attracted to pigment.
Right.
So if you have dark skin, we really can't use this on you because
No,
it's attracted to your actual skin tone.
Right. And those are the really, really bad cases you see on TikTok and Instagram floating around is the African American who went somewhere and somebody told them that this was a good laser for them. And they've got stripes of pigment or hypopigmentation. They look like a tiger. And
it breaks my heart because as a medical provider, I can't imagine not knowing the basics of a laser and telling someone who has a darker skin tone that I can treat them. And then I actually burn them to the point of scarring them. Like they're probably not going to get a lot of that pigment back.
No, it takes so much. It takes a lot of topicals, a lot of like microneedling. You're trying everything you can. This is interesting though, this is not for that person, but if you do get a little hypopigmented spot, using Latisse repigments.
Great tip.
Repigment the area. But you're not like pouring a bottle of Latisse all over your leg because you got botched hair removal, but you can repigment with Latisse.
Yeah. So what can you expect during this laser? We have failed to mention that almost all of these lasers that we've mentioned require numbing cream.
Yeah.
So depending on the intensity, you are getting numbed for 30 minutes up to an hour. And we also have this really
shout out to Manatee Pharmacy really
shout
quick
him out.
Because we used to have really shitty numbing cream and we were like on the hunt to find really good numbing cream. We used a bunch of bad ones. And we found him. He's in Bradenton, and he's the best. Yeah. He makes the best numbing cream in the country. He comes to a ton of conferences with us and has his little booth, and he came up to us the last time we were at Saiton. And he's just phenomenal, and his product is top notch.
There's no way we could do these CO2 lasers that we're talking to you about that have 10 days of downtime without his numbing cream. We've never found a numbing cream like this. We brought on Morpheus 8, and the numbing cream we had wasn't cutting it. Lauren said it was shitty. I literally think it was hemorrhoid cream, so it was actually shitty. But it could be used topically on your face. Don't worry. And then we were just like, okay, we can't offer these lasers with. I mean, you're not going to torture somebody. No. So shout out to Hamad at Manatee. And then
I was just texting him yesterday. So he's great, and he gets us stuff so fast. So if you are an injector, you need a good numbing cream, reach out to him. It's Manatee Pharmacy, Bradenton, Florida. He ships to like most states around the country, and tons of people use him now.
So going back to like
numbing,
so we do like to numb for all of the ones that we've mentioned, and also the BBL that we're talking about right now, this photo laser, because if you don't have it, some people may be able to tolerate it. Most people
It's
Me and
just
Lauren
very
probably
snappy.
won't. Yeah, it's warm and it's snappy. It feels like a rubber band on your skin. I do feel like this could be a lunchtime laser because none of that pigment really comes to the surface
Mhm.
for a few
For a few
days.
days,
You
yeah.
have a little bit of pink.
Mhm.
You might have some swelling at 24 to 48 hours.
Right.
But this, when you do the BBL alone, I think this is a fantastic laser for pigment. We've done Lauren's whole face, chest, neck, arms.
Yeah.
You can do, I mean, you could do your legs.
I'm going to do my legs.
You should.
I'm going to in the fall. I
Um,
am going to do my arms and my legs again. It's been probably 2 years since
since
I've done like my full arms. Because you remember when I got tiger stripes and then I went to Cabo and living my best
she
life.
decided that she should do a IPL laser, which we would tell all of our patients not to do before her bachelorette trip in Cabo.
Okay.
So then we were swimming in the ocean, and she
I'm like noticing these like stripes coming up because the areas that were treated were clear, and then my like little freckled spot that wasn't was like super intense.
okay. This is a
I
perfect.
gotta show you the picture though. Yes, because
This is
I
a
looked like
perfect
a tiger
learning
for 2
point too.
months.
Yes, you did.
2 months.
A good learning point in why we will never go back to any
Other technology.
light technology besides the Cyton is because of what Lauren experienced.
Yeah.
Cyton BBL technology is like no other.
Mhm.
It has
It has AI technology in it
Mhm.
actually, so it can curve to
Your
contours, and it's got this little arm that looks like this mic, and it's AI. It's driven by AI technology. It's
and it has
fantastic.
like overlap built in.
Yes.
So you don't get that little bit of
Space.
skin that I missed on her is basically what she's telling everyone.
You know, I think the first time I did it myself.
You did.
I did it myself.
I didn't recommend it.
I don't do anything myself anymore. That was when I was like a young lad, and
Well, I mean, you kind of
I'm just
could,
like,
but
"Deek,
yeah,
deek, deek,
I'd
deek,
rather
deek."
you not.
And so, anyways, that was my that was my own fault. Megan cleaned it up. It was totally fine.
Yeah.
But it was quite comical. So don't get a laser and then go to Mexico.
Don't do that.
Don't
Okay,
do
so
that.
browns also really great for people who have rosacea. The reds in your
Yes.
skin, whether it's just like a
Rosy
pink that doesn't
cheeks.
go away, or if you have, some people have like right by their nose, they have these little telangiectasias or facial
Mhm.
vessels. This is perfect for that. This is also great for, I mean, to be honest, someone like me who I don't have a lot of pigment, I don't have rosacea, but I want the anti-aging benefits of it.
Yeah, it's a great anti-aging laser. Dr. Bitters, who's like the king of
Mhm.
Sciton, I mean, he's 70. He's in his 70s,
He looks
isn't he?
40.
Oh, easily. He has done 200 and something BBLs, and which is a lot. I mean, it's hard for me to get 3 a year.
Yeah.
So he's done 200 plus BBLs, but his skin looks flawless. It looks like a
It's-
30-year-old skin easily. So BBL has an anti-aging component in it,
Mhm.
which they actually studied out of Stanford
Yeah.
and came out with a whole paper on it.
Yeah. We can link that too. Stanford School of Medicine basically did 3 BBLs on a 70-year-old. They took a biopsy before, they took a biopsy after. Her skin was behaving younger
Right.
than before her first one. So not only can we make your skin look like a filter and remove the bad pigment, the yellows, the reds, but you know that when you're getting this laser, you are also getting some collagen stimulation and you are anti-aging, which
Absolutely.
who,
I'm
who
here for
doesn't
that.
want? So the cost of this is anywhere from 500 to 800 per session. You need multiple sessions, and then you should definitely get maintenance sessions yearly.
Yeah, easily. So I think the biggest thing with lasers, well, this goes with everything that we do. We haven't found the fountain of youth quite yet. Like
We're searching.
we're here and helping, but none of these things, Botox isn't one and done, fillers not one and done, lasers aren't one and done, microneedling, everything that you do requires maintenance. So you can get these procedures, and then having somebody make you a maintenance plan after that
Yeah.
is crucial. I typically tell patients, let's do 1 to 3, depending on what laser we're picking, right up front. You stack them up. That's how you're going to get these amazing best results. And then you need to maintain with at least 2
Agree.
to 4 per year.
Agree.
If you have the time and the budget, just think about doing it every quarter. If not, and you want to kind of just like do your 2 minimum, like 1 in the fall, 1 in the winter, that's a great option as well, but you have to be doing something maintenance wise.
Agree.
Otherwise, you come back in 2 years and we just have to start all over again.
Yeah, yeah. And, we do live in Florida, and so naturally the summer months are just brutal. I have some patients that I trust that are starting these lasers, BBL, Moxi, around now,
Yeah.
and I've told them, "Hey, like I want you to go live your life. If we have to do one maintenance session in the fall, let's do it. Let's
Yeah.
just clean up the rest of that pigment." I also wanted to make a note, and I know you talk to your patients about this a lot too, is that lasers are so great to prep your skin before surgery.
Yes.
I've been talking a lot to patients that are probably about to get a facelift, and I'm encouraging them to do one of our aggressive CO2s before and then do one after.
Yeah.
Same with a BBL. If you've got some pigment, let's clear all of that either before or after, because your facelift is not going to give you volume back.
Right.
It is not going to clear your skin up.
No.
It's not going to produce collagen. So we need all of the things.
That's a huge misconception of just like, oh, I'll go get a facelift and make it all better. But if your skin looks like crap, then like, okay, yeah, you have tighter skin.
Yeah.
But who cares?
Exactly.
And we didn't really touch on skincare when it comes to these, but you do have to follow very strict protocols. You're off of your actives. You're not using any sort of acids. You're not using retinoids. You're not using any of that. You're really on what Megan and I would pick for you is just like a barrier kind of rebuilder,
Yeah.
right? You strip everything down and then you got to rebuild the barrier back up. And so we really love hypochlorous acid spray, which is great for inflammation. I put almost all of my patients on it, not just for bacteria, but truly the anti-inflammatory benefits of it. So it's great after lasers. It's great for the summer when it comes to melasma and rosacea, and then some HA serum and just really supportive skincare. So that's key. Making sure you're following aftercare. Your laser takes 20 or 30 minutes. It's easy for us to do, but what you do after makes or breaks your results.
Yeah, you have homework, so
Yeah.
don't skimp on that.
Yeah, for sure.
Okay, that is the laser lowdown. And very, very quickly, we went in depth with you, but we hope you understand or have a better understanding of what lasers can do, the benefits of them, who's the right candidate. If your head is still spinning,
Right.
just send us a DM. We would love to answer any questions you have.
Yeah, and if you're local, then we love doing consults. So you can come in. We recommend consults for every single laser patient because of the prep that we put into it.
Agree.
If you're a regular patient, sure, I can kind of prep you at your other appointment. But if you have questions or you've never had a laser, come in for a consult. Let's talk about your goals. Let's put you on proper skincare ahead of time, prep you, and then we can make sure that you get the best results.
Yes.
Yeah.
Okay, great.
So thanks. We'll see you next time.